Hello everyone, my name is Adam Michael Anthony Simpson and you're watching my YouTube channel Adam M.A. Simpson. Thanks for watching part 1 of the interview featuring Dr. O'Daniel O'Sullivan, or who we call OD. Please stay tuned to watch more. So we're going to move on to the second half of the interview, which is how does your work benefit the Jamaican society? So, Daniel, I know that you have been on ground zero of Jamaica's fight against the COVID-19 pandemic ever since the start. Can you talk us through how the pandemic affected Jamaica and how it continues to affect the island today? I know Jamaica is going through a surge, so please tell us what's going on.
Well, I think so. Definitely, yes. Being in internal medicine puts me on the front lines for the pandemic here in terms of healthcare delivery. Just like the world, COVID has affected every area of life that you can imagine, our education system, or private and financial sectors.
Entertainment
Industry, or tourism industry.
Which is the biggest breadwinner for the island.
Exactly. That's how we get our revenue, in other ways at least. And our healthcare system, which has been burdened pre-COVID. So now this is just insult to injury, so to speak. So the COVID-19 pandemic has affected us in ways that, are unspeakable, and each person will or can relate their individual experience. But I think from a healthcare point of view, when COVID started over a year ago here, and when we had our first case in March of last year, March 10th was the first.
Wow, you remember it?
And, patients have to be in a isolated area, but again, each institution, healthcare institution, under the stewardship of the Ministry of Healthcare, you have to come up with your own hospital protocol.
Yeah.
And everything would have to start from once the patient, either they called before, because we did have the country had a hotline service where you could call in, say what symptom you have, and then the ministry representatives can direct you.
Ministry of Health
representative can direct you to the necessary facilities. So as a hospital, from our experience, the hospital administration have to come up with a protocol from start to end. End is patient recovery.
Wow.
Through the hospital, and it didn't even end there, because then in terms of the ministry, they had to do contact tracing. So whoever that person interacted with, they had to try to see if those persons have any symptoms and ensure that they are placed in quarantine for a time. So it's just to go through an entire protocol involving different specialties in the hospital, from the emergency doctors to us, the internal medicine, with a critical care specialist. So it involved a lot of persons, and again, the fear of COVID in and of itself, for healthcare workers being human as well, and thinking about in delivering patient care, I put myself at risk.
Exactly.
And I also have families. I also have
going out in the communities, and you can spread it.
And that kind of thing. So the question of how do I properly protect myself, and here you give the government credit, you give institution credit for providing some of the basic things, masks, gloves, PPEs, those are the protective gears, to ensure. One of the things that most hospitals had to do was to convert regular wards where patients are housed into special COVID wards.
Yeah.
And as the numbers increased, more and more non-COVID wards became COVID wards, and it was overwhelming for me personally in the beginning, just because of the entire experience, both from a physician and a patient experience. You're in a you're on a ward, your families can't visit you, there's no face-to-face interaction. Some patients are ill, very, very ill. They have to be put on high oxygen, some are intubated. And just to think about just the human experience from, a patient and their family's point of view, that was disheartening, as well as not, you try to reassure patients or give them some hope, but in the same breath, you're thinking about your own exposure, you're thinking about the time you're spending on the ward. So the humanitarian aspect of delivering patient care, I think, because of exposure and not wanting to contract the virus itself, was on a lot of healthcare workers' minds then. But I think as the year progressed, our numbers fell initially, and whether it's a sense of complacency or whatever it was, we had a surge. So to date, in the country, we're on weekend lockdowns for the next 3 weeks to date. I guess we'll see how that will progress over, the upcoming weeks. But it goes to show that COVID really, it's not a healthcare worker responsibility, it's each individual. And again, your approach to COVID in terms of the spread comes down to the value system that you have personally. Do I value someone else's life as much as I value mine to take the necessary precautions? Because again, it's a contagious virus, which means it's human interaction, and it takes discipline, because it can be hard to not see your family for weeks, or not going to social events like you're used to. It takes discipline and some strength of character to adhere to all the laws to protect. Again, it's for the greater good.
Yeah.
Right. And it's a toss-up between instant gratification now versus in a year we'll be able to have our freedom to be as we once knew through COVID. So I think at the end of the day, it comes down to that. Each person has their own responsibility. Yes, as a doctor, I will have responsibilities to care for when patients are ill, but prevention is always key. And I think, that's the main thing for each citizen of whichever country, taking that personal responsibility to say, I value the life of a stranger enough to not go out when I shouldn't. I value their life enough to wear my mask, to ensure that I sanitize at each point. So again, those things, we go back to the basics. You're taught that, whether at home, whether at school, whether at church, to value another person's life. And I think COVID has shown how selfish some persons can be, but it also
definitely,
it has shown the bravery, the courage,
definitely,
the serving attitude of others. So it really is a mixture of taking the positives from the pandemic to try better society. And I think as time progresses and as people are slowed down somewhat and appreciate, again, the not so little things, we'll be a better society for it.
Yeah.
So, COVID was far-reaching for us, and we still have challenges here, especially resources, thinking about resources, oxygen, bed space.
All of those stuff have to be imported.
Yes, and especially the human resource as well, because we were short-staffed as a healthcare system pre-COVID, and now with more demand on the system, it's like, some divine intervention to push through. But again, not to lose hope, for me at least. I try to see how we can use the problems that we're having today to fix the system. So if and when another pandemic hits, which I really hope it doesn't, but if it does, we're more equipped to, or better equipped to handle that situation.
Well, thanks for that response. And has the pandemic affected, I mean, as an internal resident, internal medicine resident, it's work, but also school at the same time, because you're working towards being an internist, and then potentially after that, any other field that you'd want to get into. Has it affected your, education as an internal resident because you're so set on the pandemic?
So, I mean, definitely it has. As you mentioned, residency is a training period as well.
Yeah.
And in medicine, or learning generally takes place
on the floor.
On the floor, and it's kind of a apprenticeship period where you learn from someone else, and they relay their experience and guide your training, as well as it also involves lectures. For me and the other internal medicine residents here at University Hospital, we were affected in terms of more so the didactic lectures, the tutorials, because there was a halt in that process. In terms, COVID, it's new, and no experience in and of itself is wasted. So we did learn. We had to learn quickly as well as the numbers got more and more, how to do more critical care, because some of the patients were gravely ill, and how to deliver care in that setting. So yes, the pandemic has helped our training in terms of how to handle the respiratory disease, COVID-19, and the different treatment protocols. And again, the positives from the pandemic, the vast information that came from journals, from trials abroad, and different medications that are being experimented, and see how useful. It's good to be a part of history and something emerging, and knowing that this is now a period, because it was a sacrifice for us in terms of our academic training, to be on the front lines and staff in the COVID team and helping these patients recuperate to their health. I think one of the things, however, notwithstanding our program being on hold in terms of the teaching, residents still had to do exams. And, exams in and of itself, it takes a level of preparation. And having to study for the exams, as well as being on COVID, and, burnout in terms of just physical exhaustion and mental exhaustion, just because of everything that COVID carried with it, or carries with it, because it's still ongoing. It's a lot to have in your mind to sit an exam. So I think it definitely has affected us both in a negative and positive light in our training. But again, being in a profession like medicine, where you serve others and you do so out of humility, it's only an honor to be a part of a profession where you can help in this regard, to help others in such a time like this, that even though our academics probably was put on the back burner, we're still helping society, and we're still trying to we're trying to help to go back to the norm. And not exclusively everything that was pre-COVID, but at least to where people don't have some of the burden that they have on them now.
Well, when you say like I mean, it's the same thing that happened in the States. Interns still have to take their final exams and stuff. So I think it's a global issue, with just being in a pandemic, and being in healthcare. But yeah, my heart goes out to you and everyone that's like in the internal medicine program in Jamaica right now. So, and thank you for your service. What would you communicate to Jamaicans about what it is like to take charge of COVID-19 patients?
Well, the truth is, words will never do this justice.
Well, then can you like make up your face and scream, or I don't know?
But yes, you definitely have days when you just want to scream.
Wow.
You definitely have days when you go on the ward, and as much as you hope and pray that a patient goes through just how ill they are, you know the outcome will be less than favorable. And
yeah.
As much as, you know, we're surrounded by patients dying, just because of the number of deaths that you will see and you will hear reported globally, and the fear that's, you know, driven into these patients, and the loss of hope for some, that can be very challenging. And it's challenging on all levels, from a medical professional level, from just a human level, where you're wondering, how can I help? How can I really help this patient? And you think about everything that you possibly could do. But at times patients still die, and they will just succumb to COVID. Those days are horrible. There are days when you physically wondering, how are you going to get the strength to push? I think somehow, divinely, our staff, as short-staffed as we are, we bring our A game every day. So as difficult as it is to experience that, it's gratifying and it's fulfilling when you can discharge a COVID patient. You can say, oh, you can go home, you don't need oxygen. And you know, and they're relieved, and their families are relieved, and you see when the family see them for the first time since their admission, when they're being discharged, and how happy and how grateful, and the appreciation of life, of leaving a hospital alive is. And I think those things are heartwarming. And definitely here in Jamaica, corporate society, the sponsorship that, you know, the healthcare workers and other institutions get from private sector, it's admirable and commendable. There are days when we get little thank you packages, and those things, as not so little as they are, they mean so much to us. So you have days like that. So the experience, just because it's a novel virus and you really don't know how well treatment will work for X or Y patient, the statistics come, and they come quickly. However, in terms of, you know, if you know the history of research and how trials go for a drug, it can be varied amongst the population. So you don't know how the Jamaican society will react to X drug just because of our genetic makeup. You don't know, some drugs are still in trial. You know, you're just trying to throw the kitchen sink at the patient, everything that you have available for good outcome. So yes, so it's varied. I think as a society, a Jamaican society, as I said, the responsibility is on each person to lessen the numbers. The less patients you have to manage in such a pandemic, the more effective care will be delivered, the more one-to-one staffing you can provide. So definitely the experience as a doctor, it's mixed emotions, but again, the sense of complacency, the remiss of, you know, of me to say, we love this. We don't. We do not love it. We want COVID to go away and go away as soon as it can.
Well, okay. And then, what would you communicate to an international audience about what it is like to be a medical doctor in Jamaica?
Okay. Jamaica in of itself is a beautiful place. It's a beautiful country.
I was thinking about that today.
Yeah, so being in Jamaica, it's great, and it's home for me. So I love being here and helping the Jamaican people. Being a doctor in Jamaica, wow. It can be very difficult at times, as I mentioned. Even before COVID, there are days when you just want to scream. Want to scream. Or major challenge probably would be physical resources and manpower to help meet our demands, especially at public hospitals.
Yeah.
In terms of training, our training is top notch. I appreciate the training that we get here.
I think the training is top notch.
And I think despite our resource challenges, we are very innovative and we practice guideline-based medicine, evidence-based medicine, and we can
and publish as well.
And we publish. We have a lot of research here as well, definitely, and we have some of the best doctors that you can find anywhere in the world. And I think that in and of itself speaks to the training, speaks to our education system, and the values that are imparted to us. With any system, there will be challenges, and I've come to appreciate that. And again, when I look on the challenges here, I'm not despondent, but see it as an opportunity for me to be a change. And I think with our doctors understanding that this is the system that we're in, this is the legacy I want to leave, this is the impact, the medical footprint I want to leave, I think it has pushed us to become self-driven and motivated to deliver a first world care in a third world setting. And we definitely can stand among some of the, more financially stable countries, and say in terms of our patient care delivery and our medical training, that it is as good and sometimes better than some of these places, and I'm grateful for that.
Yeah, and I wanted to add that, these lacking resources is not something that's unique to third world countries, because it's the same thing happening in certain community hospitals in the States as well. But I think the resourcefulness that Jamaican doctors exhibit every day is something to be commended.
Yes, definitely. Yeah. Definitely. And I mean, the truth is that when it comes down to it, I think most of our doctors here, we're passionate about what we do. We're very passionate. And I think, and just interacting with Jamaican people, whether they're at the hospital or we're a unique set of people. So even on what you would deem your worst day, you go to a clinic and there's
somebody doing something and it's hilarious.
And you're just like, and it eases the stress of work.
Yeah.
So definitely, I think we're passionate about our jobs and we love our Jamaican people.
Yes.
And
we're a laughing set of people. So.
Exactly, and it makes work a little more tolerable and lighter. So being a doctor in Jamaica, it's has been great for me so far, and I have more
Mm,
years
many
in
more
the
years.
sector. So I guess we'll see what comes of that in the upcoming years. But definitely, if you can come to Jamaica and work as a doctor, go through the channels and come.
Yes, great. And then, okay, last but not least, my favorite question: what misconceptions of what misconceptions of medical school in Jamaica would you like to dispel for our younger viewers?
Wow. Well, I guess the main one will probably be a general thing that when you're in med school, you don't have a life kind of thing. I I don't think, as I mentioned before, anybody should be boxed in, whether it's based
Mm-hmm.
on your profession, your social background, nothing should box you in. I think medical school it takes discipline to get through, and it takes a different level of focus, sure. But I also think that to say you don't have a life, that's a big misconception. I think you can make the life that you want, no matter if it's
Exactly.
med school, engineering school, business school, nursing school. You can make the life you want. So
Mm-hmm.
you do have a life, and you should have a
Exactly.
life. You should have a life
Yeah, you should have a
outside of
life.
it.
Yeah, I wanted to add to that too. It's something I've been listening to the Michelle Obama podcast. And I don't know. And the Renegades podcast with Barack Obama and Bruce Springsteen. Yeah, that okay. Yeah. But I wanted to add that in the modern era, especially with social media, where I want to tell everyone that the image that somebody puts out there on social media is curated, that is not the real person. So, but we put this image of ourselves out there, and we want it all instant gratification, and we must have it all right now. And a lot, as you said, a lot of people say medical school, you don't have a life. That isn't true. I mean, yes, there is some sacrifice with time. You're in a season of your life where you're in training, and you have to sacrifice to get fruitful outcomes. So, yeah, I wanted to say that nothing comes easy. Nothing comes easy, but we can incorporate ourselves into our schedule so that we can get to the finish line. So, yeah.
Yes.
Thank you for bringing that up, because this is something that's been on my mind.
Okay, good.
Awesome. Thank you so much, Daniel. I think this episode was amazing, and I think that you are really going to inform an international audience of a Jamaican experience, but a Jamaican intellectual experience, which we don't have the opportunity to show all the time. So you are a great example of another beautiful side of our amazing island. So thank you so much, OD.
Okay. Thank you for this opportunity as well.
It had to happen. It had to happen. I was just waiting to have it. So I hope you have a great rest of your Sunday, and I will see you soon, hopefully, fingers crossed, in person. Okay. When everything, yeah. All right. Cool.
Thank
see
you.
Lodi. Yeah. Bye.
Bye.
Thanks for watching the completion of this interview featuring Dr. O'Daniel O'Sullivan. Please stay tuned for next week and like and subscribe to the channel, because that helps me so much to make this content for you. Stay tuned.